During the COVID-19 pandemic, cases of acute stress and post-traumatic stress exponentially increased. According to the World Health Organization, there has been a 22% increase in cases, with these being 5 times more frequent than usual. We know that the symptoms of a post-traumatic stress, such as anxiety, depression, and more, tend to increase as time passes. But after more than a year of being exposed to SARS-CoV-2 virus, can we qualify the COVID-19 pandemic as a traumatic event? What do the experts say about it?
Health Facts Now. Your health at a click.
Hi, I'm Dr. Jonathan. Today, we're going to talk about the psychological impacts caused by COVID-19.
Acute stress and post-traumatic stress are mental disorders that have been very prevalent worldwide during this global pandemic. According to the Diagnostic and Statistical Manual of Mental Disorder, post-traumatic stress disorder is diagnosed if the person has been directly exposed to a traumatic event or if they are aware of a close third party who has experienced a traumatic event. Due to the current context of the pandemic, we see that there are several countries that continue to have problems coping with the virus. In this case, we can differentiate countries based on their ongoing exposure to the traumatic event. What are the symptoms of a post-traumatic stress disorder? How does it present in the body and mind? Post-traumatic stress disorder symptoms include intrusive memories, disturbing dreams, and intense and prolonged physiological and physiological arousal. These symptoms occur when a person is exposed to internal or external factors that resemble one aspect of the original traumatic event. For people experiencing post-traumatic stress disorder, there are also reactive alterations in behavior, such as irritable behavior, outbursts of anger, physical or verbal aggression against people or objects, self-destructive behavior, hypervigilance, and an exaggerated startle response. So far, there are 3 types of stressors linked to the pandemic. First, there are stressors related to the direct impact that people experience when they are diagnosed with COVID-19. Second, there are stressors that healthcare workers have been exposed to over the course of the pandemic. They have witnessed day by day the direct impact suffered by patients with COVID-19. This fact affects healthcare providers' mental health severely. One of them affirmed,
"Well, I couldn't bear so much pain and suffering. I was so frightened that I experienced an emotional crisis."
Finally, there are stressors linked to the socioeconomic consequences of the pandemic, such as the loss of employment and economic income due to the closure of numerous businesses. Unfortunately, the psychological effects of the pandemic do not end there. The negative impact of sanitary restriction measures, although necessary, such as quarantines and social distancing, is notorious. Also, due to the absence of social support, many people who suffer from mental disorders experience an increase in the severity of their conditions. Due to the current context of the pandemic, we see that there are several countries that continue to have problems coping with the virus. In this case, we can differentiate countries based on their ongoing exposure to the traumatic event. Similarly, the incidence of post-traumatic stress changes according to countries. In Italy, for example, in a sample of 2,286 cases, 30% reported having mood alterations, intrusions, dysphoria, and anxiety. In China, in over 2,091 cases, only 5% reported to have suffered from poor sleep. And in Mexico, in over 3,932 cases, around 30% reported having intrusive thoughts, hyperactivity, and avoidance of the traumatic event.
In conclusion, after more than a year of exposure to the SARS-CoV-2 virus, psychological consequences throughout the world are still unknown. Post-traumatic stress has the characteristics of being a chronic disorder that can lead to depressive states, maladaptive behaviors, anger, frustration, and anxiety in people who suffer from it. In consequence, this produces a significant impact on the social life of people. If you or a friend's mental health has been affected, you can make an appointment with some of our professionals by visiting www.healthfactsnow.com. There you will be able to find more information about the topic. This has been a short review of the psychological impact caused by the COVID-19 pandemic.
And remember to be critical of everything you learn, even what you learned today, in Health Facts Now.
Health Facts Now. Your health at a click.